Hello friends, this is Dr. Nikita Nanwani here, and in this quick video we are going to learn the tricks to remember the various parameters and changes in various types of shock. So we have a hypovolemic shock, cardiogenic shock, obstructive and distributive shock. In distributive shock, basically we have septic shock, anaphylactic shock and even neurogenic shock. So what is happening is, remember, in all types of shock, there is hypotension and there is tachycardia, except for neurogenic shock, where we have hypotension with bradycardia. Because remember, in neurogenic shock, what is happening is there is loss of sympathetic tone. So parasympathetic predominates, so there is bradycardia and hypotension. That is first point to be remembered. Going to the next one, as you can see, in all the shocks, the cardiac output is low. But in distributive shock, the cardiac output is high because the systemic vascular resistance is low. The heart is pumping against the afterload, the PVR, the SVR. So in septic shock, so the bacteria release the substances which cause the vasodilatation, decreasing the systemic vascular resistance, so the cardiac output increases. So rest of the shocks, the systemic vascular resistance is high, but here it is low, so the cardiac output is high here. Now the next part that you can see here is the venous pressure. Venous pressure is high in cardiogenic and obstructive shock. Cardiogenic shock is where the heart is failing, so it is not taking the blood. So there's all the backflow, so the venous pressure is high. Same as obstructive shock. The difference is in obstructive shock, there is some extrinsic factor, extrinsic pathology, which is compressing the heart. So in cardiogenic shock, it is intrinsic cardiac pathology. In obstructive shock, it is some extrinsic cause, which is compressing the heart and preventing the heart from functioning normally. Mixed venous pressure, basically you can remember, is JVP. So the JVP is high in cardiogenic and obstructive shock. Mixed venous saturation is high only here in septic shock, distributive shock. So imagine the bacteria releasing the substances, toxic substances, not allowing the tissues to utilize the oxygen. So whatever blood is going to the tissues, it is not being utilized, the oxygen is not being utilized. So the venous oxygen saturation is going to be high in septic shock. Base deficit, you can see, is high in all the shocks. Quickly revising this with another table here. So the right atrial pressure and the PCWP, the pulmonary capillary wedge pressure, which indicates the left atrial pressure. Left atrium back pressure is the pulmonary veins, right? So this is going to be high in cardiogenic shock because there is back pressure. Cardiac index is high in septic shock because there is vasodilatation. So the pumping is actually more. Systemic vascular resistance is low in septic shock. It is high in the other two, hypovolemic and cardiogenic. And MVO2, the venous oxygen saturation, is going to be high in septic shock. So these are the quick points to be remembered about shock. Remember it with concepts. It makes things easy. I hope you've liked this video. If yes, do not forget to share it with your friends. And do download Radsynapse app by Dr. Nikita for learning more such tips, tricks, and easy concepts. Thank you.